This is Duke University.
So I'm Associate Director of a new center on Duke's campus called the World Food Policy Center. And the point of the center is to really connect what we view as very sort of isolated or disconnected groups within the food policy arena.
I am the president of GPSC, as Rochelle mentioned, which is the Graduate and Professional Student Council. So we've really been picking up the needs of students across the past 3 years that I've been serving. And we've seen food and nutrition, accessibility and affordability as an ongoing issue.
We first start talking about what is food insecurity and what is the difference between food insecurity and hunger.
So there's a lot of difficulty in measuring food insecurity, and there's a variety of different definitions. Some people might think about it as, do you have enough food? Are you hungry? Are you not hungry? So when we think about food insecurity, there's multiple dimensions. One of them is your ability to access it, but then also its availability. So then there's also utilization. So is the food safe enough for you to eat, or the food itself might be low nutrient density? We're mostly measuring caloric availability. Did you have access to a certain sort of quantity of calories, and not talking as much about the quality?
And another part of that is how consistently do you have access to food? Do you have access to that same food every single time? Rashmi, you started your pantry. Can you say why you started the pantry and what you hope to accomplish with that?
We started to identify the need of food insecurity as a problem among graduate and professional students. And this was from students just coming to us and saying that they didn't have enough money to go grocery shopping that week. They were living off of $25 in their checking account. Some people had lost their scholarship for that month. So it clearly was a need, but it was not consistent across the whole student population. And this past year, we started the Community Pantry. It's located at the GPSC house, which is on Alexander Avenue, and it basically provides food. So it was started through a pilot grant provided by the graduate school. So we're in collaboration with the graduate school on this issue because they addressed that it was also a need and they wanted to help in as much as they could. So they gave us a $2,000 startup. We bought the supplies and the input food that we needed, and now we have childcare supplies. We're accepting donations. We also hold professional wardrobe that's been donated, so it's gently used professional wardrobe from students and staff and faculty. And I think the childcare items have been the most highly in demand and highly used products for students with children. And so far we have 13 different programs represented from all across the graduate and professional schools. Mostly master's programs are in need, and I think that's because Ph.D. students receive a stipend. So again, even within the graduate school, there's variations on income, so financial insecurity is also a huge variability, has huge variability.
So I think that there is a lot to understand, at least on college campuses, and in essence, campuses are microcosms of a larger society, and whatever the problems are that exist in a larger society exist on college campuses. It's just at different varying levels of the university. And you would think, well, we're at Duke, but Duke or any university is not immune to food insecurity.
How do people fall through the cracks at a wonderful supportive institution like Duke?
We had a few students come talk to us, and I mean, students were undergraduate, law, business students, all students, divinity students, all come and share some experiences. But I'll give you an example of a student that came to us and talked to us, and I think they came to the larger group. The student came and reported that he was a full-time student and he was food insecure. And he was going to restaurants and stealing packs of ketchup and living in his car, as well as being a student. How is that possible? Well, can he go get some more financial aid, or can he ask someone else for help or something like that? But the funds are limited. They're not unlimited funds to give, so, you have certain qualifications you have to meet. There are laws around financial aid. There's laws around all kinds of things and where the university does its business. So sometimes a student falls out. And so we were very fortunate in October, we got the names of 6,000 students, and we sent our survey out. Remarkably, we got 1,500 responses from that survey. And of that survey, we got close to, I can't remember the number right off, but it was more than 70 students report that they had eaten out of a trash can in the last semester. This is where we are, and I'm sitting here thinking that can't possibly be. And we did find that there was food insecurity.
I think there's a difficulty of how do you find these students that are struggling that aren't going to ask for help? So how do we as a university better target solutions towards people who aren't really going to come to us? And there is a higher incidence amongst people of color, and then also first-generation students as well. So I think that's interesting to note. And then I think there's a lot of just people think of students as having two parents supporting them at school, and at least in one survey, that's 74% of the population is actually in sort of a non-traditional student model now, where they're more mature students coming back later in their career. They are a parent, they're a single parent, they have no support from anyone else in their family and are financially independent, or they're a combination of all of those things. So in terms of what other campuses and universities are doing, there's definitely some food pantries being put into place. But as a group, we talked about there's a lot of stigma associated with showing up at a food pantry. And so how do you address that? There's food recovery programs where, when you walk around Duke, there's so much free food at these events and the dining halls. I mean, it doesn't look like a food desert when you're at Duke University. So how do we do some food recovery at these big events where then there's always leftovers? Campus community gardens, I would say that's part of, like, how do you get the fresh produce into some of these programs? Campus farmers markets that are subsidized. And then expanding SNAP eligibility, that's a Supplemental Nutrition Assistance Program, the new sort of name for food stamps. Could students that are not food insecure donate some of their meal swipes, because at the end of the year, sometimes they wind up having a surplus. So there's a lot of great solutions. I think there's these like gaps in some of the getting to the benefits.
I wanted to share a couple of the challenges and then successes of the pantry, because that addresses some of the topics that you brought up. So I'll start with successes. Firstly, so we've had institutional support from the graduate school, as I mentioned, and we've also seen, like I said, a large variety of students coming in. I think the biggest success that we saw through the council is that we were able to leverage our kind of breadth and reach into students as a student government organization to hear students' concerns about food insecurity. Another thing that was great was that, so I also had kind of these expectations about the stigma of entering into a pantry, but the people that have come in so far have actually asked me if they needed to write their names down, what information we wanted from them so that they could contribute to the data collection. Speaking of institutionalization, we have had a lot of help from the administration, but clearly this is a problem that the student council can't exactly solve on our own. So it's definitely a conversation that needs to happen on a higher level.
I think the university, all universities are trying to grapple with this issue, and how do you create policies and practices that make most sense for the university and for the university community. And it's not simple. I think that's why we haven't eliminated or eradicated food insecurity in our world. It's bigger than just, a university trying to tackle this for a few students. It's a university trying to tackle this as a university and create policies that are fair and equitable for all.
Mm-hmm. Thanks, Rochelle. Yeah, and I think you're right that it is sort of a microcosm of larger societal issues. But I do think technology could play a role in that. How do you ID and target the students that are at highest risk, and then find ways to do more outreach to them?
Where do you see the greatest need? Is it in private, elite, public schools, or is it universal? And then is there a student type, undergraduate, graduate, professional?
Amongst the graduate students, as I mentioned before, there's so much variability. If you have children, if you have a family, if your one stipend that's meant for one individual is stretching across 3 or 4 mouths, it's very difficult to make ends meet.
Just anyone at a certain socioeconomic level. I mean, they certainly, there's this concept of if you live in a food desert where there's less availability of food in grocery stores, so that's a problem. But a new study came out saying that it's not just living in a food desert, it really is just your socioeconomic status.
Have you thought in your groups and in your work about, cheap food versus food, and how does that fit in the food insecurity equation?
Yeah, I can speak to that with regards to the pantry and the food that we have available. So, when we are thinking of what foods to buy for the pantry, we obviously, cost is an issue, so we try to go cheaper. But we actually don't have a lot of processed foods, so the only canned foods we have are canned veggies, and everything else are whole grains that you can kind of cook. We actually were told by the university that we can't have perishable foods.
In communities or families that are suffering from food insecurity, they actually have higher risks of obesity or non-communicable disease because of the sort of quality of food that you have available to you. Often there's this tussle of it could be shelf stable, it could be safe, or it could be fresh. And you can generally right now only have 2 of them.
So do you all have any ideas where we can start at least knowing where things are located so that we can share those with students? Because as you were talking about the shame issue of it, I want to be able to say right away, like, oh, go here and you'd be able to find help, right? Versus just being like, I'm sorry. And then all of a sudden, in some ways, they've kind of lost that opportunity.
So what we've done from our end is we pushed out the pantry through the DGSA network, which reached a lot of different graduate programs, and they were able to, push our flyers through their networks. And we also plan on advertising it during all the incoming student orientations.
A great point, and I think we maybe even need to step back and ask students, like, if you needed help, what would you do, or where would you look? And then finding ways to distribute that information there.
I think the greatest thing we all will do is find a way to create central repositories for all this information, because even if they create a financial plan, then you've only got that group that has that. We need it to be central and to have a central home on Duke, and I think.
And I think changing the culture around asking for help.
So one of the things you talked about is how do you get to the people that need these services. So I actually work with this particular issue in a K through 12 program in Orange County, and how they identify a lot of the kids is not just the school social worker, but the teachers and the mentors for these kids. So I think getting this information out to your various faculty mentors throughout campus that, if you see a student struggling, these are the options that we have. These are the services that are available across campus. I think hearing it from a mentor that it's okay to accept help is very different than seeing a flyer